Well, welcome everyone to the Dayton VA Medical Center Social Services webinar. We are thrilled to be here with you tonight. I want to start by saying this event is being recorded, so if there's something you missed and later want to rewatch, you'll be able to do that. We will be sending you a link to that recording after this event. You can also share that link with anyone you feel may benefit from this information we're sharing here tonight. I'm Scott Leese with the Community Outreach Office at the Medical Center, and I am an Air Force veteran, and like many of you, once had many questions about VA healthcare. Let's see if we can answer your questions here this evening. Please realize that as a participant in this session, your microphone has been muted to minimize distracting background noises. We have quite a few participants on this webinar tonight, so we're just trying to keep everyone's muted and keep the background noises down. Again, that is simply not to have any distractions while we're doing this presentation. That doesn't mean we don't want to hear from you. If you have a question or a concern, you can share it with the panelists anytime through the chat pane. You should be able to find that pane on the bottom right of your screen. Simply type in your question, and one of our presenters will get to you as soon as they can. For the sake of time, if we don't get to your question during this presentation, you can reach us by phone or email, and we'll provide that contact information at the end of the presentation. Now I would like to take a few minutes to have our director, Mr. Mark Murdoch, introduce you to your Dayton VA Medical Center.
Hi, I'm Mark Murdoch, Air Force veteran and director of the Dayton VA Medical Center. I'd like to welcome you to the Dayton VA, one of the largest and most historic veteran medical centers in the nation. This campus began as a soldier's home in 1867, providing medical services and rehabilitation to Civil War soldiers. Though the campus has changed over the years, our purpose is not. Just as President Lincoln instructed all those years ago, our mission remains to care for him or her who shall have borne the battle. We do this by putting you, the veteran, at the very center of every decision we make. Whether it's the revitalization of our historic grotto and the healing gardens, the addition of a new MRI suite and simulation center, our community-based outpatient clinics, which were designed from the ground up with our veterans' needs in mind, our complimentary valet parking for our veterans, or the construction of a new Fisher House to give you and your loved ones the ability to rest and recover with all of the comforts of home. Your physical, mental, spiritual, and emotional needs are at the heart of every step that we take. Here at the Dayton VA, we carefully balance our historic significance as one of the first centers for veteran health with the medical needs of the veterans of today and tomorrow. We are proud of our more than 150 years of dedicated service to those who gave us the freedoms we enjoy today, and look forward to spending the next 150 years continuing on the path President Lincoln laid out before us. Thank you for coming to the Dayton VA Medical Center, where we are honored to provide the best possible care to our nation's heroes. You served us, now let us serve you.
Thank Mr. Murdoch for that wonderful video. And actually want to tell you a little bit about the long history we have here with veterans in the Dayton campus. We've actually reached the 75th anniversary of our modern Veterans Administration, though we've been here for over 100 years. We are proud to be not only one of the oldest campuses in the VA, but we also boast one of the newest and most modern medical facilities offering top quality care. Not very many people know that the VA is recognized, according to a study done by RAND, as being one of the top medical care systems in the nation. And it's top rated by the vets who it serves with a more than 98% satisfaction rating. This is a benefit that not everyone is able to receive. This is only available to veterans, veterans like you. Well, that's one of the reasons we're here tonight. For those who are not enrolled with the VA, we hope you take the opportunity to do so now. It's easy. One of the ways to enroll is to actually come and visit the Dayton Medical Center and stop by our enrollment and eligibility office. They will be glad to help you walk through the process. You may want to call them first to schedule an appointment. You can call them at 937-267 7608. They will tell you what documents you need to bring and what you need to do for eligibility. For the tech savvy, you may also enroll online at www.va.gov. And veterans also can reach the National Call Center to apply by calling 877-222-8387. And finally, veterans may also download an application and mail in the application directly to the Dayton VA MC. You can also enroll in person at the surrounding community-based outpatient clinics, also known as CBOCs. They are located conveniently at Lima, Middletown, Richmond, and Springfield. And you can see the phone numbers there on the screen, but we'll also be sharing that contact information again at the end of the presentation. Now, the reason we're here tonight, let's hear from our subject matter experts who can tell us more about how veterans can receive vital benefits from the VA, specifically how they can receive care through the VA social services.
Good evening. My name is Babette Hartnellms, the Chief of Social Work Service at the Dayton VA Medical Center. I have been providing social work services to veterans for the past 15 years. Tonight, my staff and I will talk to you about services we offer veterans at the Dayton VA Medical Center, as well as at the community-based outpatient clinics. And we encourage each of you to enroll in health care at the Dayton VA. Our mission is to provide timely resources to help veterans and their families through crisis and help them live a better quality of life. The first person I'm going to introduce is Kim Powell. She is the ambulatory program manager, and she will speak to you about services her and her staff will provide for you.
Social work ambulatory care programs include Dayton PAC and CBOC social workers, the Intimate Partner Violence Program, Post 9/11, Medical Foster Home, Advanced Care Planning, and the Emergency Room. The program consists of 14 social workers, 1 RN, and 1 MSA. Social workers or case managers identify the need for social work assessment and services via the Social Work Comprehensive Assessment and/or the Relationship Health and Safety Assessment. We provide outreach to veterans, families, and/or caregivers to determine needs, arrange, coordinate, advocate, and/or provide interventions for veterans and families. We evaluate needs with the veteran's preferences leading the discussion. Review psychosocial acuity and initiate a plan for ongoing follow-up and intervention. Developing attainable, measurable objectives and goals based on values and preferences of veterans and families, and implement psychosocial interventions.
Now we will have Patrick Cook, Program Coordinator for VA Hospice and Palliative Care.
The Dayton VA Hospice and Palliative Care program serves veterans with a serious or life-limiting diagnosis and their family members to improve their quality of life. The care is holistic as it considers the veteran and family's physical, emotional, psychosocial, and spiritual needs. This is accomplished through an interdisciplinary approach with such specialties as hospice and palliative care physicians, nurses, social workers, pharmacists, chaplains, dietitians, psychologists, and recreation therapists. Depending on where the veteran is on their disease journey and their goals of care, the Dayton VA Hospice and Palliative Care program may be beneficial through our outpatient palliative care clinic, contracted home hospice services, or our 12-bed inpatient hospice unit. We strive to provide peace and comfort to those we serve during this difficult time in their lives, as well as after the veteran's death. Bereavement support is offered to the surviving family of veterans who expire at the Dayton VA for up to 13 months following the veteran's death.
The next person you are going to hear from is Julie Thomas, the Program Manager for Acute and Extended Care.
The acute and extended care team consists of social workers working on the acute medical, surgical floors in inpatient psychiatric floor. The Dayton VA Medical Center has 60 acute care beds. The acute care team provides social work assessment, advanced directive education, and discharge planning, in addition to linkage to other community resources. On the team, there is also the spinal cord injury coordinator and the social worker assigned to the hemodialysis unit, as both these programs have frequent contact with the acute program as well as extended care. The extended care staff work on the skilled nursing care inpatient rehab floor, as well as our 4-unit community living center. Lastly, there is a social worker co-located at Wright-Patterson Air Force Base that provides connection and discharge planning for veterans receiving medical care there.
The next person you will hear from is Betsy Strebel to talk about the Fisher House and Hoptail.
The Dayton VA Medical Center Fisher House provides temporary accommodations, a home away from home, at no cost for the families, caregivers, friends, and loved ones of hospitalized veterans and service members who are traveling a long distance, usually 30 miles or more, to Dayton VA Medical Center. Fisher House has 16 private suites with a private bathroom, common area kitchen, dining room, living room, family room, and laundry room for guests. In addition, veterans who are traveling 30 or more miles for outpatient care at Dayton VA Medical Center or care in the local community requested by VA are eligible to stay at Fisher House with an accompanying guest to help lift the burden of traveling a long distance to Dayton. The Dayton VA Medical Center Fisher House was built by the Fisher House Foundation through generous donations and gifted to Dayton VA Medical Center. Since opening in 2018, Dayton VA Medical Center Fisher House has provided temporary lodging for more than 1,200 veteran families, caregivers, loved ones, and saving our veteran families more than $450,000. The Fisher House mission is to provide 5-star accommodations for the loved ones of veterans so that they can be present and supportive for the veteran when they are receiving medical care, because a family's love is good medicine. Fisher House accommodations can be requested through the Veterans Medical Care Team or by calling the Fisher House directly at 937-267-3900. Fisher House receives generous donations from our local community to help provide exceptional services for the Fisher House guests. The Dayton VA Medical Center has another program called Hoptail. Our Hoptail program provides hotel accommodations at a local contracted hotel for veterans who are traveling 50 or more miles to the Dayton VA Medical Center for medical care. A Hoptail request can be facilitated by a medical provider or by calling 937-268-6511, extension 2887.
The next person you will hear from will be Erin Heyman, Program Manager of the General Caregiver Support Program.
The Caregiver Support Program is a program that takes care of veterans caregivers. It is made up of 2 separate programs. The first being the Program of General Caregiver Support Services, or known as PGCSS. Within this program, caregivers can receive peer support mentoring, skills training, coaching, telephone support, online programs. To be eligible for this part of the program, a veteran must be enrolled in VA care and receiving services. However, the caregiver does not need to be a relative or live with the veteran. The second part of the program is referred to as the Program of Comprehensive Assistance for Family Caregivers, or known as PCAFC. Within this part of the program, a caregiver can receive mentoring, support group, mental health services, as well as a financial stipend. In order to be eligible to apply for this program, a veteran must have served between 2 different times, either before May 7, 1975 or after September 11, 2001. They also must be 70% or more service connected. We are excited to announce that October 1st, 2022, we will be expanding this program for all veterans to apply, no matter their service area.
In summary, we hope that we have encouraged you to seek out the VA for services and enroll in healthcare benefits. Here at the Dayton VA Medical Center, we offer many services to assist with veterans' needs. The Social Work Service Department is located in Building 330 on the first floor. We pride ourselves on caring for veterans' needs. For more information, you can call the Social Work Department at 937-268-6511, extension 2122. Or for the Caregiver Support Program, you can call 937-268-6511, extension 5425. And again, thank you for your time.
As we hope you've learned from that video that we just watched, there are a wide variety of services at the Dayton VA Medical Center that's provided by our social services. However, you may still have a lot of questions, so we put together a panel of experts to help answer those questions. We have with us live this evening Bobette Hartnellms. She is the Chief of Social Work Services at the Dayton VA and serves as the Principal Advisor on Social Work Professional Practice and has been in this role since December of 2019. She has worked at the VA since 2007. Kim Powell is currently the Social Work Ambulatory Care Programs Manager at the Dayton VA MC. She manages social workers and RNs, and prior to this, she was a homeless program manager from 2015 to 2020. Kim has 22 years of service with the VA. Betsy Streibel is the Dayton VA Medical Center Fisher House Manager and has 14 years experience working for VA. She is a licensed professional clinical counselor and worked in private practice for 12 years prior to coming to VA. Patrick Cook is an Air Force veteran and the Hospice Palliative Care Coordinator at Dayton VA, and he has over 10 years of VA experience with more than 8 years of hospice experience, both at VA and in the community. Filling in this evening for Aaron Hyman is Rita Warwick. She is a licensed independent social worker. She has worked at VA for 13 years in prime care and home-based primary care and recently moved to caregiver support. Julie Thomas is currently working as the Acute and Extended Care Program Manager for Social Work Services and has worked at the Dayton VA for over 23 years. She attended graduate school at the Ohio State University. And again, I am your host, Scott Leese with the Medical Center's Community Outreach Office. I am an Air Force veteran, and I will help answer any questions you might have about the Dayton VA Medical Center in general. Now we're going to take some time to answer your questions. We've received a couple in the chat pane. We've received 3 or 4, I believe, so far. So please remember, if you have any questions, feel free to ask it by typing it into the chat pane. We'll get to it as soon as we can within the time remaining we have this evening. If we don't get to your question, please know we still want to answer it. We will give you a way to contact us at the end of this presentation. So our first question is, what are the recent changes to patient check-in at the VA? They've seen some signs in the lobby and want to know about that. So for many people that have been coming to the VA, they are used to going to the kiosks at the different clinics and checking in there. Now you can actually enter the main lobby or any of the clinics and you'll see a QR code. You use your device, either your smartphone or tablet or whatever device you might have that would read a QR code, and you can check in that way. It's a lot faster. It's actually a lot simpler. But if you don't have that capability, not to worry. We're still very friendly there. We still have people that you can actually talk to. All you need to do is walk up to the counter and talk to somebody to check in. So do not worry that if you don't have a smartphone or a way to read QR codes, we're still human beings here at the VA, and all you need to do is come up and ask for some help, and we'll be glad to check you in. Our next question, Jerry wants to know, how can someone apply for the Caregiver Support Program?
The best way to apply for the caregiver program would be to go on the National VA Caregiver website and fill out the online form. It's called a 1010 CG. You can also print the form off and fill that out and bring it into the social work office in building 330, and we'll get you started with the evaluation.
Okay, thank you, Rita. Mary wants to know, why choose the VA and in particular social work services? And so Bobette, would you want to handle that question?
Yes. Why choose the VA? Because we specialize in veteran care. We truly understand what veterans need from one era to the next. So we specialize in that. We have multiple services that we can provide for you, and we care. You know, the biggest thing that you're going to find out here is that we care about veterans' needs, what they need, uh, you know, what they want. We help them to achieve a better quality of life by helping them meet their goals. And so we feel like we are the experts in veterans care and that we can provide you with what you need. And we have plethora of services that will accommodate you and help you.
Fantastic answer, Bobette. Next up is Mike. He's asking, are there still restrictions for coming in for an appointment to the Dayton Medical Center? There aren't restrictions per se, Mike, but there are some precautions that we're still taking in relation to the COVID-19 pandemic. This is a medical center, a treatment facility, and we want to make certain that all our veterans who are visiting are taking every precaution possible. So yes, we're still asking everyone who visits the medical center that they still wear a face mask. There are face masks that are provided at the lobby when you come in, no charge. Take as many as you need. Just be sure that you put a face mask on. We also remind everyone that children under, I believe, age 12 are not allowed in the facility also. So if you're coming to visit a patient, keep in mind that we want to make sure that everyone is safe, and we're really asking that you do not bring children to the medical center. Next up, Kay is wanting to know, how do I get hospice palliative care?
That's a good question. It's really a conversation with your primary care provider. And that'll revolve around, your diagnosis, your condition, and really what are your goals of care and what are the treatment recommendations. Your primary care provider can place a referral to the appropriate resource from there.
Great, Patrick. Thanks for that answer. Now, that's a reminder that you want to go to your primary care physician, but we need to make sure that you're enrolled first. So take that step. That's one of the first things that you do when you actually sign up for VA healthcare, is that you are assigned to a primary care clinic and you get an appointment with your primary care physician. And that would be the time to be asking those types of questions as well. Next up, we have Mark. Mark would like to know, how can a social work assist with nursing home placement from an inpatient unit?
Okay, I'll take that question. The social worker is working with the healthcare team for the veteran on the inpatient unit. And so those conversations and assessments are happening that might determine that a veteran might need short-term placement or even long-term care. And so the social worker would then work with that team and also with the veteran and their family to determine which facilities might be their choice and work on making those referrals.
All right, thank you, Julie. Next up, we have a question. What information is available for the recently passed PACT Act? Wow, great question. For those of you who do not know what the PACT Act is, that was a law that was signed into effect by the president last month. It is the Promise to Address Comprehensive Toxins Act, and is actually opening up healthcare benefits through the VA to approximately 6 million veterans who are not eligible for health care before. And it is to address those concerns where veterans have been exposed to toxins. Now that goes all the way back to the Korean War, through the Vietnam War, and through the post 9/11 war on terrorism, desert conflicts and so forth with the burn pits, etc. This is really unusual because anyone who understands about VA healthcare and how to qualify for VA healthcare knows that you had to have a disability rating before to qualify at a higher level for healthcare. Right now, they have opened it up to anyone with presumptive conditions in connection with serving within certain windows in certain theaters. So there's a great resource to look at. You want to go to pactact.gov. That's PACTACT.gov, and you can see the list of different windows of service in different theaters and what presumptive conditions would qualify you for care. Now, if you don't have one of those presumptive conditions, that doesn't mean you don't want to register. If you were in theater and served between certain times in certain windows, you still want to register for the PACT Act registry. This is an advent of you needing that care. Don't wait until you need it to register. They're asking for you to register now so that you are on the list, and in advent of you actually needing the care, you're already on the list and would more easily be able to get directly into the care that you need. PACT Act number is 800-698-2411. You can also call that number for more information. Again, that number is 800, excuse me, 800-698-2411. Our next question comes from Joe. Joe wants to know who can be a caregiver in the Caregiver Support Program.
Thank you, Joe. The caregiver for the general caregiver side can be anyone who is helping a veteran. The veteran has to be enrolled in the VA, and the caregiver, it doesn't matter if it's family or friends, that could be from the general caregiver side. On the comprehensive side, that is the side with the stipend. The caregiver has to either be a relative, or if they're not a relative, they have to be living with the veteran. But basically, if a veteran says they're my caregiver, they can be part of the caregiver support program.
All right, thanks, Rita. Sally wants to know, do you have to be an unenrolled veteran or enrolled veteran to enroll for the PACT Act? Actually, it doesn't matter. If you're already enrolled with VA healthcare, they're still asking you to register for the PACT Act registry. It might actually increase your care, give you a higher disability rating. So we want to remind everybody, even though you're enrolled, you still want to enroll with the PACT Act registry. And if you're not enrolled, of course, yes, please enroll in that registry. Greg wants to know, is there a cost for VA hospice and palliative care?
Thanks, Greg. There could be a copay for outpatient palliative care just based on the veterans enrollment priority group, just like other specialty appointments at the VA. However, there's no cost for hospice care, and that's for either VA coordinated home hospice care or on our inpatient unit.
All right, thank you, Patrick. Next up, we have a question. If I apply to caregiver support and I am denied, what is my next step?
So the next step would be to file an appeal with the Patient Advocate Department at the Dayton VA. You can also stop in the social work office, and our support staff, Laura Hoban, would also assist the veteran and the caregiver, and point them in the right direction. But the best way to start would be with the patient advocate.
All right, super, Rita. Thank you. Next up, Sam wants to know, where does hospice take place?
Thanks, Sam. Hospice is a philosophy of care, so it can take place wherever the veteran is, really. So home hospice refers to wherever the veteran is, and that could be their house, an apartment, an assisted living, a nursing home, where the hospice team would go to where the veteran is. And if their care needs exceed that level of care, we have an inpatient hospice unit here where a veteran could be admitted for comfort care.
Okay, fantastic, Patrick. Thanks. Karina would like to know, will hospice care shorten my life?
There are a lot of misconceptions about hospice, and hospice doesn't speed any process up or slow any process down. It allows the disease to take its course, and we focus on comfort and quality of life rather than quantity. So however many days we have with the veteran, we try to make those the best days the veteran has.
All right, terrific answer, Patrick. Thank you. I just want to remind everybody, if you have a question or concern or just a comment you want to make, feel free to put that in the chat pane. We're actually coming down to our last couple of questions, so this would be the time to enter your questions now in the chat pane. Next up, we have Hal, and he wants to know, what can a veteran admitted to the hospital expect from a social worker?
Thanks, Hal, for the question. So every patient that gets admitted to the hospital, our team of social workers will see them within 24 hours of their admission. So we're talking to the patient about any discharge barriers, any needs they have. We're also talking to them about advanced directives, if they have one, if they want to make changes, or even to create a new one. So and, we certainly would address any psychosocial needs that the veteran has while they're in the hospital.
Okay, thank you, Julie. Looks like we have our last question here, unless somebody else comes up with another one. Brandon would like to know, how can a social worker assist with nursing home placement from an inpatient unit?
Yeah, so I think I touched on that a little earlier, and so really the social worker again works with that healthcare team, works with the veteran and the family to make sure that's the right level of care, and also look at their options either in VA or in the community. So hopefully that's addressed. Thank you.
All right, thank you, Julie. Is there any of our panel that would like to add anything else for this evening's presentation?
I wanted to add something. I think it was the first question that was asked, why choose VA and social work services? I think what I've found is um, social workers at the VA, most of us come from the community before we come to VA. So we're very well aware of community resources. So we not only provide our patients with VA resources, we provide them with community resources as well. I think that the community social workers at various hospitals or nonprofit agencies have a much difficult time knowing what VA resources are. So I think that's a plus. We know both sides of the coin, and we're able to give the veterans all of the information from both VA and community.
Great point, Kim. And I think there's something else that I would add is that, especially with social work, there are so many different programs that you all offer that are unique that you're not going to find elsewhere in the community. It is geared and driven towards care for veterans and their special needs. And I know that you guys offer a whole lot of other services other than just the ones we talked about tonight. But we can If you guys have any questions about that, you can always contact Bobette and her team. She's giving you that number that we can make sure that we get back out to later on. And again, it's just, there's so much care out there that you're just not going to find anywhere else other than coming to the VA and getting that specialized care that only the VA provides. Go ahead.
And another good plus about coming to the VA is that every person who is assigned to a PAC team also has a social worker that if they have something come up, they can always call and get information and directions and also get referrals to community organizations. So every veteran has a social worker when they're admitted to the PAC team, or whether they're admitted to inpatient, or if they're admitted to caregiver support, or if they're admitted to any of our programs mentioned here tonight. There's always a social worker to help and direct. And not only that, we pride ourselves on being resource driven and also angels. We help, in areas that you don't know that we are able to help. We're always there, and we're always thinking of how to help you with any issue that you have. We're always trying to plan out a solution. So social work at the VA is wonderful, and it also is there driven for the veterans, by the veterans.
Absolutely. Great words, Bobette. Thank you. If there is nothing else from anyone, I think we'll go ahead and wrap that up. We don't have any other questions, but we hope that everyone that joined us this evening found this event to be both helpful and informative. If we didn't get to your questions, there's something you want to ask us direct without asking everyone else, not to worry. You can call us at 937-268-6511, extension 2035 or extension 2195. Again, that number is 937-268-6511, extension 2035 or extension 2195. Or you can call Eligibility Enrollment Office at 937-268-7608 for any questions you might have about how to enroll with the Dayton VA. Again, there are several options for enrolling with the Dayton VA Medical Center. If you're not currently enrolled but would like to enroll with the Dayton VA, here's how you can do it. First and foremost, come on down in person. We'd love to see you. Just stop by the Enrollment Eligibility Office. They'll be glad to help you out filling out the proper forms and gathering up the other information. Also at our community-based outpatient clinics, you can go in directly. Or if you are more inclined to do things with tech-savvy technology, you can go online and go to www.va.gov. You can also call that National Health Center eligibility number, and that number is 877-222-8387. Or again, download that form 1010EZ and mail it to the Dayton VA at 4100 West 3rd Street in Dayton, Ohio, 45428. You can also enroll again at those surrounding community-based outpatient clinics, or they're also known as CBOCs. You'll hear that term quite often. They are conveniently located for those folks that are in Lima, Middletown, Richmond, and Springfield. You can see their phone numbers there on the screen. And that pretty much wraps up our event for this evening. We hope we've answered your questions about our great social work services and the Dayton VA in general, and hope you're ready to enroll. Thanks to our panelists for all the great information they shared with us this evening. And thanks again to everyone who attended this event. Have a great rest of your evening, and thanks to all our veterans for their service to a grateful nation.